Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Today, we're diving into a condition that's both incredibly severe and somehow surprisingly easy to miss: catatonic depression. It's a deep, profound struggle that so often happens in complete silence. In this explainer, we're going to break down what it is, exactly why it's so misunderstood, and, most importantly, how it can be treated so effectively. Okay, so let's get right into it. To start, we really need to get this definition clear. Catatonic depression is not just about feeling incredibly sad. It's a dual condition. Think of it this way. It combines all those familiar emotional symptoms of major depression with a whole other set of really distinct and sometimes pretty alarming physical symptoms that affect how a person moves and speaks. And that dual nature, right there, is the key to understanding everything else. And that leads us to the central puzzle of this whole explainer. I mean, if a person can become totally immobile or just stop speaking altogether, how on earth could that be overlooked? It seems impossible, right? Well, that's the mystery we're going to unravel. The answer is all about how those symptoms get interpreted, or more often than not, misinterpreted. So here's our game plan. We'll start by really digging into the silent struggle itself. Then we'll get practical and cover how to recognize the signs. After that, we'll walk through the diagnostic process, explore the incredibly helpful pathways to recovery, and finally, take a look at what life is like after treatment. First up, the silent struggle. You know, this whole section is about getting a handle on that core challenge of catatonic depression, that two-sided illness where the emotional and the motor symptoms are all happening at the very same time. And here's why getting that is so critical. The physical motor symptoms, like being unable to move or speak, can so easily be chalked up to something else. A doctor or a family member might just see it as, extreme exhaustion from the depression itself, or maybe even a side effect from a medication. But when that catatonic piece of the puzzle is missed, the entire treatment plan can be wrong, delaying care that isn't just helpful, but is often literally life-saving. Which, of course, leads us right into our next section, recognizing the signs. This is where we arm ourselves with the knowledge to spot the key clues, so we can turn that confusion into recognition. Now, what I love about this slide is how clearly it separates these two sets of symptoms. On one side, you have that internal experience of depression, the low mood, the hopelessness. On the other side, you have the external, physical things you can actually see, the catatonic features. The person is going through both at the same time, and it's that combination that really defines the condition. So here's the crucial part. A formal diagnosis isn't just based on some vague impression. The DSM-5, which is basically the handbook for mental health professionals, says you need at least 3 specific features from a list of 12. And these can range from the quiet signs, like stupor and mutism, to more active ones, like agitation or even mimicking the words and movements of people around them. It's a very distinct clinical pattern that doctors are looking for. So who are the people who are actually going to see these signs first? Well, it's a pretty wide net. It could be family members at home who notice their loved one has become eerily withdrawn and still. It could be ER staff trying to figure out why someone is unresponsive. All of these groups are the absolute front line, and their awareness can make a huge difference in how quickly someone gets the right diagnosis. This brings us to the investigation phase. So how do clinicians actually confirm what they're suspecting? Let's look at the diagnostic process. This isn't guesswork. It's a very clear, methodical approach that's designed to get to the right answer and to do it quickly and safely. The process really unfolds in these clear steps. It always starts with a clinical assessment, using those DSM-5 criteria we just talked about. Next, and this is super important, they do a full medical workup to rule out any other illnesses that could be causing the symptoms. Then comes this really fascinating step called the lorazepam challenge. A small test dose of this medication is given, and if the catatonic symptoms dramatically improve, sometimes in just a matter of minutes, it's a very strong indicator of the diagnosis. It's like a diagnostic test and the beginning of a treatment all in one. Now, it is absolutely vital to know when this crosses the line into a true medical emergency. These are the red flags. If a person is refusing to eat or drink, if they're becoming dehydrated, or if their vital signs are getting unstable, this is not a wait-and-see situation. These signs mean the body is in crisis, and immediate hospitalization is non-negotiable. All right, so after covering the struggle and the diagnosis, we now get to shift to the most important part of this entire story, the recovery. This is where the narrative really turns into one of profound hope because the treatments for catatonic depression are, believe it or not, remarkably effective. If you take away only one single thing from this entire explainer, please let it be this. Despite how severe and scary it looks, catatonic depression is one of the most treatable severe psychiatric conditions out there. The key, the absolute non-negotiable key, is getting a prompt and accurate diagnosis. With that in place, the outlook is incredibly positive. And this number just illustrates that point perfectly. Remember that lorazepam challenge we talked about? Well, it isn't just a test. Benzodiazepines are the first-line treatment, and they work for the vast majority of patients. A 60 to 80% response rate. I mean, in the world of medicine, that is a huge, huge number. It's a massive source of hope. So this table lays out the two main evidence-based treatments. Benzodiazepines are the first choice, and they offer rapid relief. If for some reason those don't work, or if the situation is truly life-threatening, then electroconvulsive therapy, or ECT, is used. And I know it might have a scary reputation from old movies, but modern ECT is an incredibly safe and highly effective medical procedure with just fantastic response rates for catatonia. So, what happens after that immediate crisis is over? Our final section takes a look at life after treatment. The focus here really shifts from that acute care to maintaining long-term wellness, and maybe most importantly, preventing a relapse. Recovery is an ongoing process, and it's supported by a really clear strategy. This includes, of course, consistent medication management for the underlying depression, but it's also about things that empower the patient and their family. Having structured routines, engaging in psychotherapy like CBT, and making sure the family is educated on what to look for. These are all absolutely essential pieces of the puzzle for long-term stability. And this quote from our source material really just sums up the entire message, doesn't it? Timely treatment leads to good outcomes. This is not a life sentence. It's a treatable condition where acting quickly makes all the difference in the world. Early recognition and a fast response are everything. So we'll end with this question. The treatments are there. The science is solid. The biggest barrier that's left is just simple awareness. Knowing this, how can we, all of us, help bridge that gap? How do we make sure that this silent struggle is finally heard so that every single person affected can find their way to the hopeful, effective recovery that they absolutely deserve?
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.